The Effects of Prune Juice on Bowel Function by Gretchen, Emma, Lindsay, Alice, and Remy. Our PICO question. Our population is post-operative patients with the intervention of consuming fruit juices or dried fruits compared to the current practice of only using a stool softener, with the outcome hopefully promotion of bowel movement, decreased length of stay, and patient satisfaction.
The background. The inability to promote a bowel movement is a common issue among many patients, especially those in the postoperative setting. Constipation in the postoperative patient has been secondary to medications, decreased movement, and underlying medical conditions. The current treatments used for constipation include medications such as bulking agents, stool softeners, laxatives, and pyrethylene glycol. We chose this topic to explore the alternatives to the current bowel protocol and attempt to find non-pharmacological ways to promote bowel function.
Studies. The first study, which was a randomized clinical trial, dry prunes versus psyllium-free constipation, is a level of evidence of randomized controlled trial, category C. The main article mentioned that it was a study designed to find novel alternatives for patients living with constipation. The Prune treatment tested to improve the symptoms of constipation, especially more regarding with psyllium treatment. Some of the strengths of it is that participants receiving Prune-produced stool softener had higher complete spontaneous bowel movements per week and feel better than participants receiving psyllium. Another one is that patients didn't have any adverse effects such as bloating, and both treatments were effective. However, the Prune treatment showed superior results objectively and subjectively. The weaknesses of the study is that there was a small sample size of 40 participants, and it is a single-blind randomized study designed with potential crossover effects.
Second study was a systematic review of the effects of prunes on GI function. Level of evidence was a systematic review, category C. The main points were the results that showed that the results prunes significantly increased stool frequency compared to psyllium. Prunes also softened the stools more than comparison, which was grape juice, dried apples, low-fat cookies, and psyllium. Did review several different articles on the subject. However, there was no specific group included in this setting.
The third study, chemical composition and potential health effects of prunes, a functional food. The level of evidence was a systemic review, category C. The article's main points found that prunes contain a biological compound called sorbitol, which contributes to laxative action. The process of microfermentation within the GI system increases flatulence and softens stool. The strengths of the study found that the analysis of results are clearly demonstrated in tables and figures within the study. The weaknesses found that further research is needed to conclude the effectiveness of prunes as an alternative to current bowel regimens in the postoperative patient.
Our final article is Prunus domestica as effective and acceptable treatment for stool softening and relief of constipation symptoms. Level of evidence is systematic review, category C. Main points of this article are that consumption of Prunus domestica aids in treatment of mild to moderate constipation. It can help decrease colonic transit time, bulk the stool, and increases frequency of bowel movements. The article found that the average prevalence of constipation in adults is 16%, and age, family, gender, diets with low fiber, medication, travel, obesity, stress, lack of exercise, and diseases can all lead to constipation. Strength of this article was that 10 clinical trials were reviewed with a variety of sample sizes and ages, and study types included randomized control style trials, single studies, and demographic reviews. And then the weaknesses were that the study reviewed take place over an average of 4 weeks and no long-term effects were studied. So our recommendations that we found based on our research is number one, we recommend that more research takes place, especially in the post-operative patient population. And two, that some derivatives of prunes, such as prune juice, be given to patients in the post-op period to promote a bowel movement, decrease side effects associated with stool softeners, and enhance the overall patient experience.